NCLEX RN Quiz Bank 2026 questions to test a wide range of topics. Question 1. Nurse Ron is assessing a client with second and third degree burns on the face, arms, and chest. Which finding indicates a potential problem? Option A, partial pressure of arterial oxygen, POW2, value of 80 mm Hg. Option B, urine output of 20 ml/hour. Option C, white pulmonary secretions. Option D, rectal temperature of 100.6 degrees Fahrenheit 38 degrees Celsius. The correct answer is option B, urine output of 20 ml/hour. Normal urine output should be at least 30 ml/hr. An output of 20 ml/hr in a burn patient suggests inadequate fluid resuscitation or impending acute kidney injury. Question 2. Mr. Mendoza has suffered a cerebrovascular accident, CVA, and is too weak to move. To help the client avoid pressure ulcers, Nurse Celia should: Option A, turn him frequently. Option B, perform passive range of motion, ROM, exercises. Option C, reduce the client's fluid intake. Option D, encourage the client to use a footboard. The correct answer is option A, turn him frequently. Repositioning the patient at least every 2 hours is the most effective nursing intervention to relieve pressure and prevent skin breakdown. Question 3. Nurse Maria plans to administer dexamethasone cream to a client who has dermatitis over the anterior chest. How should the nurse apply this topical agent? Option A, with a circular motion, to enhance absorption. Option B, with an upward motion, to increase blood supply. Option C, in long, even, outward, and downward strokes in the direction of hair growth. Option D, in long, even, outward, and upward strokes opposite the direction of hair growth. The correct answer is option C, in long, even, outward, and downward strokes in the direction of hair growth. Applying topical medications in the direction of hair growth helps prevent irritation of the follicles, folliculitis, and ensures even distribution. Question 4. Which class of medication protects the ischemic myocardium by blocking catecholamines and sympathetic nerve stimulation? Option A, beta-adrenergic blockers. Option B, calcium channel blocker. Option C, narcotics. Option D, nitrates. The correct answer is option A, beta-adrenergic blockers. Beta blockers block the effects of catecholamines like adrenaline, decreasing heart rate and myocardial oxygen demand, which protects the heart after a knee. Question 5. A male client has jugular distension. In what position should the nurse place the head of the bed to obtain the most accurate reading of jugular vein distension? Option A, high Fowlers. Option B, raised 10 degrees. Option C, raised 30 degrees. Option D, supine position. The correct answer is option C, raised 30 degrees. Jugular venous distension, JVD, is most accurately assessed with the head of the bed elevated at a 30 to 45 degree angle. Question 6. Which class of medications maximizes cardiac performance in clients with heart failure by increasing ventricular contractility? Option A, beta-adrenergic blockers. Option B, calcium channel blocker. Option C, diuretics. Option D, inotropic agents. The correct answer is option D, inotropic agents. Positive inotropic agents, such as digoxin, increase the strength of the heart's contractions, thereby improving cardiac output in heart failure patients. Question 7. A male client has reduced HDL and elevated LDL levels. Which of the following dietary modifications is not appropriate for this client? Option A, fiber intake of 25 to 30 g daily. Option B, less than 30% of calories from fat. Option C, cholesterol intake of less than 300 mg daily. Option D, less than 10% of calories from saturated fat. The correct answer is option C, cholesterol intake of less than 300 mg daily. For clients with high-risk lipid profiles, dietary cholesterol should be limited to less than 200 mg daily. 300 mg is the limit for the general healthy population. Question 8. A 37-year-old male was admitted with acute knee. Which of the following actions would breach the client's confidentiality? Option A, a verbal report to the telemetry nurse before transfer. Option B, notifying the on-call physician about a change in condition. Option C, head nurse checks the latest ECG results to check the client's progress. Option D, at the client's request, the nurse updates the client's wife. The correct answer is option C. Head nurse checks the latest ECG results to check the client's progress. Hospital staff who are not currently assigned to the patient's care have no legal right to access the patient's medical records or test results.